Good afternoon and welcome to the third installment of the Adult Task Force webinar series. My name is Amethyst Johnson and I am the Manager of Information and Referral Services here at the Tourette Association of America. For those of you that are tuning in for the first time, here at the TAA we are committed to bettering the lives of individuals affected by Tourette Syndrome. We work to raise awareness, advance research, and to provide ongoing support through our Centers of Excellence, chapters, and support groups nationwide. Today we'll be discussing a topic that most individuals with Tourette syndrome face, and that is the task of identifying a care team to treat them as an adult patient. Here today to expand upon this topic is Dr. Wissam Deeb of the University of Florida. He is an experienced neurologist with a focus on movement disorders such as Tourette syndrome, Parkinson's disease, and dystonia. He has also received training in deep brain stimulation, intraoperative recording, and postoperative programming from one of the premier deep brain stimulation centers in the United States. Before we start, just so you know, while during the course of the webinar you are able to submit questions, please feel free to do so because there will be a Q&A session at the end once Dr. Deeb is finished with his presentation. Dr. Deeb?
Hi everyone. My name is Dr. Deeb, as Amethyst said, and this topic for me is very dear to my heart because I am by training I'm an adult neurologist. So seeing patients with Tourette syndrome, I usually deal with this transitioning of care to adulthood and the challenges that happen when a person moves from pediatric care to adult care. So today during this webinar, we're just going to go through this topic and discuss some challenges and resources that can be available to patients and parents to help with the transition, as well as an adult patient with Tourette syndrome. So initially, a quick disclosure of funding. I receive grant funding through the Tourette Association of America and the American Brain Foundation, but it's not directly related to the topic of this presentation today. In terms of the outline of the presentation, we're going to initially speak a little bit about the natural history or how Tourette syndrome progresses over time, especially with this transition from childhood to adulthood. What are some challenges in this transition? And then also what are some resources that can be available to help with these challenges. So first of all, transitioning from childhood to adulthood is based on our societal norms of a person reaching 18 and becoming an adult, as well as other important milestones like when they transition to an independent insurance and other types of societal transitions. And anybody who goes through these transitions goes through a stressful period at that time. But Tourette syndrome adds extra challenges because of the nature of the disorder. And so, for example, there could be urges and sensations that can distract a person, can make them have difficulty with cognitive functions because of the continuous distractions from the urges. The presence of obsessive thoughts, and also the chronic effects of tics, such as negative effects on self-esteem or anxiety that can also affect a person during this transition. So we're going to speak about some of those challenges in more details a little bit later. And it's also important to recognize that there are two transitions when we're speaking about this. So we're going to focus on these two aspects. There is the personal transition, which is anybody who's moving from childhood to adulthood goes through it. And then in modern societies, there is this concept of emerging adulthood that's expressed by Dr. Jeffrey Arnett in 2000. It expresses this period that can extend for many, many years, from 17 to 25 or even sometimes longer, where the person is transitioning from a child to being an adult with independence as the major feature of adulthood. So this is the personal transition. But in addition to the personal transition, a person with Tourette syndrome would have to deal also with medical transition. And that's moving from a pediatric clinic to an adult clinic. There is no one age for this transition. It varies from person to person and clinic to clinic. But for most people, it is usually around the age of 18 to 21 when there is this transition from one clinic type, which is a pediatric form of clinic, to an adult clinic. So let's initially remember the progression of Tourette syndrome. So first of all, the Tourette syndrome or Tourette disorder as defined by the Diagnostic and Statistical Manual edition 5 lists that if to have Tourette disorder, you would have more or multiple motor types of tics, at least one vocal tics, symptoms starting before the age of 18, so effectively starting in childhood and lasting for at least a year. So these are the features to diagnose Tourette disorder. As there are some other types of tic disorders that don't meet the exact criteria for Tourette disorder, but in general, so effectively having multiple tics starting in childhood, and thus all people with Tourette disorder will have to go through this transition period, whether it is a personal transition period with Tourette or the medical transition period. And if we look at the severity of the tics, as most of you know, the tics are going to reach their maximum, or they're going to be at their highest severity for most people in late childhood or early adolescence. So that's usually over the top here of the graph. And you see that most of the severity of the tic is going to be at that level. And then for most people, it tends to decrease over time as they progress into adulthood. And then if we ask adults with Tourette syndrome, 30 to 50% report that their tics have completely resolved in adulthood. Although this number varies a lot, and a recent study in Denmark involved 314 individuals, and then in that group, for example, 18% reported that their tics have completely resolved in adulthood. But interestingly, there was a study in 2003 by Papert and colleagues, and they asked people, adults with Tourette syndrome, who said that they have no more tics, to be videotaped for a period of time, and then 50%, so 1 out of every 2 people that reported no tics, continued to have mild tics that they were not aware of. These tics do not cause any impairment, but it shows us that there could be still, despite the fact that many people report remission in adulthood, there could be still some ongoing tics, although there might not be very severe. Now, a small percentage, though, do not follow this average change that we saw in the previous curve, and then continue to have very severe and disabling tics in childhood, and indeed some people develop their most severe and disabling tics in adulthood when they do that transition. The number, although is not very clear here, and possibly 4 to 5% of individuals with Tourette develop something called malignant tics. So these are tics that can cause significant injury to the body, such as like neck injury or skin injury, and these require emergent treatment. So just to sum this up, in most cases, most people's tics get better as they progress into adulthood. A small percentage, on the other hand, can have a worsening of their tics, or the tics become the most disabling when they're an adult. And there's a very small percentage, 4 to 5%, will develop very severe, very concerning tics called malignant tics. And it's also very important to remember when we're thinking about this transition is not to think only about what the tics are doing, but also what the comorbidities. So these are the conditions that can co-occur with Tourette syndrome, such as obsessive compulsive disorder or OCD, ADHD, the attention deficit hyperactivity disorder, and other disorders that can co-occur, such as migraines, for example. And these are present in almost everyone with Tourette syndrome. So around 90% of people with Tourette syndrome tend to have one or more of these co-occurring conditions. This is a very nice graph from a paper published in 2015 that shows the different comorbidities that occur with Tourette syndrome. This is not a comprehensive list, there are more, but these are the most common ones. And then also you can see here that there are some thickness that changes, and that thickness for each one of these comorbidities tells us the age at which they start, and then what is the proportion or distribution of when they start. And you can see, for example, that if we look at the Tourette, at the tic component, most common age of onset is going to be between the ages of 5 to around 8. Anxiety is in a similar distribution, But if we look at some conditions that can occur at an older age, you'd see mood, so mainly depression and symptoms can tend to occur later. So you're speaking about later adolescence, early adulthood, and then other conditions such as substance use or eating disorders can occur even later at the age of around 18 or 16. So it's very important to remember how these comorbidities change as Tourette's progresses over time, and then some of these symptoms are going to get better, some of them are going to occur and start happening only in that transition, and others are going to continue to get worse. So it's important to keep in mind the comorbidities in addition to the tics themselves when we're thinking about the transition in Tourette syndrome. So let's look at some of the comorbidities and how they change. So if we think about OCD, OCD is one of the most common comorbidities with Tourette syndrome. And the story here with OCD is not very clear. There are some studies that show that OCD can get better with age, and other studies show that, on the other hand, OCD gets worse. It's not very clear why there's this difference between the studies. Possibly there is an effect of ADHD, so the different groups in the studies that have had different ADHD, or also different IQ, because we know that a higher IQ is associated with an increased risk of OCD symptoms. But in general, despite these differences, we notice that compulsions, which is the tendency or the activities that are done repetitively or stereotypically, that are not tics, but they are what we call compulsions, these usually tend to decrease with age. But the obsessions, which are these repetitive thoughts in the head, or what we call intrusive thoughts, these thoughts usually do not decrease much naturally without treatment as a person transitions to adulthood. So these can continue to be a significant factor in adulthood. Now, if we move to ADHD, the features of ADHD, all of them decline with age. That includes both the attention problems or inattention, as well as the hyperactivity and impulsivity. All of them decrease with age. But for most people with Tourette syndrome who have ADHD, even though their symptoms are better, they continue to have what we call subclinical symptoms. So they don't meet criteria for ADHD, but continue to have difficulty with attention, difficulty with hyperactivity or impulsivity, and that can have impacts on their day-to-day lives as well as decision making as an adult. Some other condition, for example, sleep disorders, these tend to increase with age, so they can become bigger problems when a person transitions from childhood to adulthood in terms of their quality of life. Another important thing to consider is something called the Nosey. So these are non-obscene, socially inappropriate behaviors. So these are different than coprolalia. These are inappropriate behaviors, but they're non-obscene. These occur to around 30 to 60% of people with Tourette syndrome. They can be isolating or causing low self-esteem. So they can have very long-lasting consequences, and it's very important to address them. They're related to impulsivity and ADHD. And they can have significant impacts in childhood, but also can have persistent impact in adulthood. So it's important also to consider these when assessing the transition. So now, how can we predict from Tourette syndrome in childhood, for example? What can we use to predict outcome in adulthood? It's not very clear right now. There's not a lot of robust information to help us predict how a person is going to do as an adult, let's say by having the information when they were, for example, at the age of 13. But we know that it's not always related to tic severity, but it can be related to the impacts of having Tourette syndrome in development. So, for example, as we know, self-esteem is usually lower in people with Tourette syndrome than people without Tourette syndrome, and that might not get better, even though tics might get better with age. Another important factor is development of interests and vocations. We know that people who develop interests and vocations early on tend to do better in terms of long-term and then adult satisfaction. And also another important factor, which is a major factor to assess independence, is emotional regulation. How much a person can deal with negative outcomes, can deal with stressful situations independently, and how much anxiety is well controlled or well managed. These are all important factors that can determine outcome in the transition from childhood to adulthood. Now, initially we spoke that the definition of Tourette disorder is tics start at the age of 18, but there's a subgroup, very small group of people where tics start later, so between 18 to 21 or 25. And in most of these individuals, if we ask in more detail, they might remember tics that have started earlier in childhood. But this group of individuals seem to have a little bit a different feature or different features for their Tourette's. For example, they seem to have a higher risk of substance abuse and mood disorders, and a lower presence of ADHD, vocal tics, and oppositional behaviors. But in general, you would see a similar type of trend anyways, even in individuals with Tourette's that tics started below the age of 18. So let's go through some of those challenges in a little bit more detail. So we passed through some of them right now about how the things are progressing both in tics and comorbidities. And we're going to look at them by looking at major factors that affect quality of life. So that could be psychological impacts. And as we spoke, that could be like self-esteem, for example. Cognitive impacts that could be related to ADHD, that could be related to severe obsessions, that could be related to a lot of urges that distracts from concentration, or it could be related to executive dysfunction. Some individuals with Tourette syndrome have difficulty with executive function, which is the capacity to plan and structure. Social impacts, as we know, people with Tourette syndrome are at higher risk of having difficulty with social activities. College and work, physical impacts, especially with these malignant tics or even milder tics, and then obsessions and compulsions. So if we think about some of the things that can happen with the transition, so one of them is a person is becoming an adult, so they're going to be less reliant on the structure that the parents have created. And so usually as a child, the person would have very structured, a structured environment by the parents. They will have times for chores, times for homework. Other people effectively would tell them what to do, when to do it, and how to do it. And then as the person transitions to adulthood, that scaffolding or that structure is not going to be there. So a person would have to learn how to make their own schedule, how to plan different activities. And as we know, life is full of distractions. Also, how to deal with different emotions while doing these activities, especially if negative outcomes are present, how much a person can tolerate the stress from these stressful situations. Also thinking about financial responsibilities and how much a person can accept these ups and downs in the day-to-day activities. So, and one important challenge is for anyone is this loss of structure. In Tourette syndrome, because of mainly the comorbidities and the psychological effects of having Tourette syndrome, this might be a little bit more challenging. Social pressures are very common in Tourette syndrome. Around 30% of individuals with Tourette syndrome report some form of social difficulty. These don't start at the transition to adulthood. They start earlier, so it starts in childhood, but transitioning to adulthood causes or poses new challenges that require new solutions, and that can create more pressures. A very important thing when thinking about social pressures is to think about practice. The more social practice, both friendship, intimate relationships, the better. And a very important thing to remember for Tourette's individuals, especially with obsessional features, is to avoid perfectionism, which means to allow to accept the fact that there will be negative or setbacks. So there might be social interactions that will go bad, and it's important to go and then practice social interactions with the mindset that this can happen and it's okay if it happens, and to avoid perfectionism, which might be a little bit higher in people with Tourette syndrome. And then also to remember there are multiple resources that can help, whether psychologists, social worker, or people a person can trust that can give them guidance and give them mentorship with these different social interactions. And this will start, as I said, in childhood, but then new interactions, new stressors can happen in adulthood. In that case, also they cannot go back to their parents as much because now they're adults. And in that case, developing other resources locally where they're now living is going to be helpful. Another transition is this medical transition. And this is a very important transition that I see in the clinic multiple times, is that there is a transition in culture. In pediatric neurology or pediatric clinics, usually the model is more a nourishing, family-oriented model. It's a multidisciplinary model. There are multiple individuals involved in care. Whereas in adult care model, it's much more individualistic. Now it's the patient by themselves. Maybe the patient and their doctor only. The clinic itself, in many cases, would not have all the different resources and services. There might not be enough time. The time is even shorter in adult clinics than in pediatric clinics. So that can create a bit of a culture shock by transitioning from a model where there was a lot of support to a model where individualism and independence is much more valued. And also it's important to keep in mind that when that happens, an individual who was in a very supported environment in a pediatric clinic might not have had the chance to understand their disorder very well. They didn't know what medications they were taking, and now they go to an adult clinic and they don't have any information about, okay, when their tick started, what medications they took, what were the comorbidities, what services they need. And also the parents become less involved or cannot be involved legally unless there is some signed documents, and that can create a transition difficulty in that case. The other thing is on the side of the doctors is the adult doctors might not have a lot of information about Tourette syndrome because it's many cases considered a child disease, and that's why the level of comfort in managing this disorder might not be as good by this transition, and that can also be cause a challenge. So it's very important to improve this transition from the pediatrics to the adult medicine world. So it's very, very important to ensure that an adolescent with Tourette syndrome gets very involved in their care, understands their disorder, understands the treatments, understands the comorbidities, the services, why they're getting the services, who's giving them the services, do they need any school services, do they need any projected work services. So it's very important to involve the adolescent with Tourette syndrome early in medical decisions. And during that period of transition, so as we know that you're moving from a pediatric doctor to an adult doctor, maybe ask the pediatric doctor for a summary of the medical care that can be carried around, so that we'll have information about the disorder itself, the types of tics, how complex they are, when they were at their worst, what has been tried, for how long, what was the problem, if any, with these treatments, what are the comorbidities, so was there any history of OCD, ADHD, anxiety, mood problems, and also any of services that have been tried or are currently established. Same thing is a discussion between the family and the adolescent with Tourette syndrome about determining what are the aspects that they need for independence, and then to ensure that they have a good or successful transition. So thinking about social function, if they what is the comfort level with social interactions? Is there any limitations, any concerns? What about academic supports and services? Mood symptoms, how much there is emotional grit, which is the emotional capacity to tolerate bad interactions, any behavioral concerns, and general independence level for finances and other stuff like that. So the usual recommendation is to consider an overlap period. So you're still seeing the pediatric doctor, and then for at least 1 or 2 visits, seeing a consultation an adult doctor, so that you have this period of transition. A longer period of transition is even better, but that will be considered the minimal period of transition, at least 1 or 2 visits when you're still under the care of the pediatric doctor, at the same time starting to establishing care with the adult doctor, and this will avoid an abrupt cut in care where nobody then is the doctor for that person. Another very complex issue is insurance. I wish I can I can understand all the intricacies there, but it's very important to try to get educated as much as possible about the details and the fine print of the different insurances. Also, it's important to know at what point a person with Tourette's is going to transition from their parents' insurance to their own insurance, and what that means, what type of insurance they're going to get, and if this insurance is going to cover their services, and also if it's going to cover the doctor that they have already chosen as their adult doctor, because in many cases insurance transition is going to occur later than doctor transition. So that could be another that can create a different transition if now suddenly the new insurance doesn't cover the doctor that the adult doctor they've chosen, and they have to switch provider, or it doesn't cover anymore their occupational therapy or their CBIT provider or their psychologist. And in that case, that can create significant distress at the time of that change. Also, it's important if a person is moving states to understand that even though the carrier of the insurance might be the same, what that insurance would cover is going to be quite different. So it's very important to get acquainted with the insurances, understand exactly what they're covering and what they don't cover, and then make sure to ask about the services that are important before doing any transition in insurances. Now, going back to these personal transition things, so college is an important transition. So a person who decides to go to college or vocational school after high school, this can be a major challenge, especially depending on where the college is. So the further the college is, the less parental support might be available. So it's very important to plan ahead and determine what are the services the person needs, whether it is medical services, so how frequently and when they need to see a doctor, as well as social and supportive services. And then if a person needs some academic supports, whether it is in increased times for exams, for example, it is important to make sure that these are addressed with the college in advance. And one good office to start with is, in most colleges, there is something like an office for students with disabilities. I know the name might not apply for everyone with Tourette syndrome. Many people with Tourette syndrome don't see themselves having any disability, but that's the office that can give guidance about any of the services that are available at the college and can help navigate and negotiate the system so that if something is needed in terms of academic requirements, that can help with that. As we spoke before, finding an adult doctor before moving is going to be important because you don't want to have a disruption in transition of care. Another important thing when moving to college is that the person now would have to start advocating for themselves, for their needs. In school, that could be the parents or, let's say, the school counselor that might do this advocacy. But then when a person transfers to a college, then nobody's going to be doing the advocacy for the person. And it's very important to plan for that and plan for advocating for a person's own needs in education. Similar things occur by transitioning to work. And there can be multiple stressors there. One of them is the same thing, which is the need to self-advocate. But also, it's very important when thinking about work to think about the work environment. What is the goal, or how are people evaluated at work? Also, it's very important to get a good mentor at work that can provide support as well as guidance. That mentor might not have good experience with Tourette's, but could be a person who knows the system very well and then is capable of understanding the fact that a person with Tourette syndrome might require certain accommodations at work. Another thing to think about is living arrangements. That's something also that is important to think about when in college. And so, for example, a person might need to be living with roommates. or might be living in a very different type of environment, like moving from a rural to a more urban place or vice versa. So it's very important to think about these different living environments and arrangements and which ones might be more easy or more appropriate or acceptable. Same thing applies to transportation. Is the person going to be driving their own car? Are they going to use public transportation to come to work? And what is the level of comfort as well as the level of independence to be capable of using these different types of arrangements? Another stressful situation or challenge is when or if to tell an employer about Tourette syndrome. So many people with Tourette syndrome elect not to tell their employer about Tourette syndrome, but in some situations it might be a good idea. So this is very variable, very individualized. There's no one answer fits every situation. But if a person decides to tell their employer about Tourette syndrome, it is important to practice that disclosure, maybe with a friend, and just to make a person more comfortable when doing that disclosure. And the Tourette Association of America has some resources to help a person practice, or like some guidelines about how to disclose to an employer. And in addition, the Tourette Association of America recommends to remember 3 Ps, 3 important principles when transitioning or when navigating work with Tourette syndrome. First, to stay positive. The other important thing is to be proactive. In this case, being proactive is more of a reflective thing. So think about the strength of a person. So what are my strengths? And I try to use my strength to get better at my work. At the same time, I know what are my weaknesses, and I accept these weaknesses and I take them into account when I'm trying to, let's say, get promoted in work or try to assume a new position or a new role. And the last thing, which is very important P, is they remain to be persistent, which goes back to the principle we spoke about, which is to be capable of accepting setbacks, accepting negative outcomes. This might be a little bit of a bigger challenge in Tourette syndrome, especially, as I said, there is a higher tendency for perfectionism, and a person with Tourette syndrome might get a bit discouraged because of these negative setbacks. So keeping in mind these 3 Ps, whether it is at work or general life, is going to be quite helpful. Again, you need to advocate for your own needs. Currently, when you transition to an adult, there will not be other people who usually will be advocating. And it's very important to remember that Tourette syndrome is a recognized disability, so you will get protections through the American Disabilities Act and the Fair Housing Act. So it's very important to know your rights, to know what are those protections, and to advocate for your needs and these rights when needed. So I spoke before that comorbidities are a major factor, so tics can get better. Their effects, though, might persist, but the comorbidities, these effects can also persist. So ADHD, the symptoms get better, but people tend to have long-term consequences from it. So, for example, there could be lower academic achievement, which means that there could be limitations or less opportunities in terms of work or achievements later on. So 33% of individuals with ADHD in one study did not complete high school because of the presence of ADHD. There's a higher risk of unplanned pregnancies with ADHD, higher risk of automobile accidents, higher risk of driver license suspension. It seems that having ADHD is associated with a similar risk of automobile accidents as having mild alcohol intoxication. And treatment or management of ADHD, so let's say by stimulants, can help improve driving performance. So it's very important to consider these when thinking about this transitioning to adulthood. And then we spoke about, like, for example, transportation. What could be a good way if the ADHD is not well controlled? Transportation decisions might change a little bit. OCD especially obsessions, tend to continue through adulthood, and they can have significant disabling effect. Many cases, they are more disabling than tics, and they can have a significant effect mainly on social life and relationships. Anxiety is a major factor, as well as depression, and they can affect quality of life. Substance use is very high in adults with Tourette syndrome, up to 25 to 28%. So 1 out of every 4 people with Tourette syndrome in adulthood have at least they self-report substance abuse. And also there is an increased risk of suicidality in adults with Tourette syndrome. So it's important to keep these in mind as challenges in the transition. So now what can we do to help with this transition? What can help a person with Tourette syndrome? What can help the parents, as well as their doctors, psychologists, and to help them prepare for the transition, to help them prepare for the challenges and decrease having adverse outcomes at the end. So there are multiple resources. The TAA, the Tourette Association of America website, has a lot of great resources that are available in different formats, online, in print. And another great resource that the TAA has is the Youth Ambassador Program. So this is a program where youth with Tourette syndrome can get engaged with other youth, as well as with multiple other activities, developing leadership skills, social skills, and then help improve the self-esteem and independence. So this could be a great program to help train individuals with Tourette syndrome and help them be more prepared for transitioning into adulthood. Another important resource has been developed in a partnership between the University of Florida and the Florida Department of Health. It's not specific to Tourette's. It's general for mainly for neurodevelopmental and childhood disorders in transition. You can access it through this QR code here. So if you use a QR reader, you will be capable of accessing a PDF of this document. It has great resources. It has a number of checklists that are age dependent that help us know if a person is making these milestones and if they're achieving the transition are going to be more ready for the transition once they reach the magical age of 18, and they need to be more independent at that point. So it's very important to think when we're thinking about transitioning to start to prepare early, and then also have a certain idea about the goals for adulthood. So if the person is going to go to college or no, directly to work, if they're going to work, what type of work they're doing, what type of environment, what are their future plans in terms of family, relationships, and other aspects, to have some idea about that, so that to determine and start thinking about possible challenges and how to address them. So if we're considering this document I spoke about from the Florida Department of Health, from 12 to 14, the recommendation is that a person at that age group start being very familiar and understand what Tourette syndrome is. Also, to know what are the medications that they currently they've taken before, their doses, and also starting to get more involved in their doctor visits. And then also think about the different tasks that a person is doing on a daily function, and knowing how they can get them if they cannot do them themselves. So this is an example of a checklist. This is the 12 to 14-year-old checklist. And you can see that a person does not need to check all the boxes by the age of 14, but it's gives you a certain guideline to know if a person is going to be what type of challenges they might face during that transition, or if they might need to take a little bit of an extra time, or maybe avoid going to the college in that different state and staying in a local college if there was some issues and certain things that might be a problem. So for example, one of the checklist boxes is to assess if a person understands their health condition, how it affects their daily life, if they know their medications. Do they at least answer one question or ask one question during the visit? Do they speak with their doctors about the fact that they're going to transition at some point to adulthood? Are they capable of managing medication questions in school? And then are they capable of calling the doctor if they want to change an appointment? So this is a group of lists or activities that can be checked between the age of 12 to 14. Similar things exist for 15 to 17 and then later for adulthood. So for example, 15 to 17, you need to have a bigger independent role with the doctor. So having more time spent alone with the doctor is going to be helpful. And then also it's very important for a person who is in that age group to understand that when they turn 18, they become legally independent. And then in that case, if the parents are going to be involved, it has to require some steps for the parents to be involved in their care. So some important milestones from these documents is it's very important to use the time of adolescence to practice independence with family. So practicing managing schedules independently rather than having the family creating the schedule, having the person with Tourette syndrome create their own schedule and then trying to stick to that schedule despite the distractions. Also trying to practice managing medications and then treatments and being proactive in that regard. Also managing financial obligations. Also, we can, with the support of the family in adolescence, evaluate and assess emotional readiness. It's very important in that component to know what are the resources, how to ask for these resources, and then to know where and when to ask for these resources. And then the other important thing to always keep in mind is impulsivity, which is doing things without thinking much about their consequences. These can be a little bit higher in Tourette syndrome for multiple reasons, whether it is executive function problems or ADHD related symptoms. And it's very important to have a frank discussion with parents, with psychologists about these risks, especially as we know that there's an increased risk of substance use, for example, in the Tourette adult population. And the last things I want to say are these two important principles when thinking about Tourette syndrome and transitioning to adulthood is one of the most important principles is to accept oneself. So accepting not just the strength, but also accepting the weaknesses, using the strength to improve and get better, but also knowing what are the weaknesses and being okay with the weaknesses. Avoiding perfectionism, and then using these setbacks as learning experiences. The other one is self-advocacy. That's an important principle for transitioning to adulthood. Services that were initially advocated by parents, for example, by parents, are now going to be required to be self-advocated by the person. So knowing what are the services, also knowing what are the rights in terms of to avoid discrimination at the workplace or in housing are also all going to be important during this transition. So it's in sum, effectively loving yourself, self-acceptance and self-advocacy are going to be very important principle for anyone, but also quite important for Tourette syndrome when transitioning from childhood to adulthood. There's some references, and thank you very much for your time.
Thank you so much, Dr. Deeb. That was very informative. Okay, it doesn't look like we have any questions. If you decide that you have any questions following this webinar, please feel free to email me. My name is Amethyst Johnson again, and you can email me at support@tourette.org. Again, that's support@tourette.org. And following this webinar, you will receive a survey. Please fill it out. We'd like to hear from you and see if you have any thoughts or concerns that we can address going forward. Have a good afternoon.